For the coronavirus crisis to enter the classrooms, with plans revealed today to segregate children who have visited China.
And of course, plenty of parents are worried about sending their kids back to school this morning. So today, medical expert Dr. Penny Adams is with us. Good morning, I should say, to you, Dr. Penny. What precautions can parents take when sending their kids to school?
Well, I think in general, if you're sending your kids back to school today or tomorrow, you don't need to take any specific precautions. I think there's been a lot of panic about this coronavirus and kids going to school, with two exceptions. If you have a child who has been in Wuhan and has had contact with someone with coronavirus, they should not go back to school for 2 weeks. That's the incubation period of that coronavirus. And certainly if they develop symptoms, they need to be urgently medically assessed. If you have a child who was in the area but did not knowingly come in contact with anyone with coronavirus, they can still go to school. But obviously if they develop symptoms, then they should be assessed urgently. But I think in general, we don't need to be worried about our kids going back to school, and we don't need to have a sense of panic about this. What would John Howard say? Alert but not alarmed.
We're seeing a lot of people wearing masks in that footage we're seeing there. Should we be wearing masks? Should kids get masks on? Should schools be handing masks out at schools, or is that a bit too much?
I think that's a bit too much. I think the current recommendations would be, certainly for health professionals, they need to use the more sophisticated P2 masks, like the ones that we saw in the bushfires. But if you have symptoms and you have been in the area where the coronavirus has been, then you should actually wear a surgical mask until you're fully assessed. And if you know that you've got these sort of symptoms and you're going to be assessed, you should ring your GP or your accident and emergency department and tell them in advance that you're coming in to be assessed. And in those cases, you should definitely wear a surgical mask. But I don't think all kids going back to school need to wear surgical masks.